Welcome everybody to the webinar. We just hit the broadcast. I see people are still logging on, so let me give it a second to make sure everyone is able to come on board. If you have questions, type them in the question and answer. That's the best place. We have quite a few people, several hundred people signed up for this, so we'll be able to get to your questions, but the microphones will be turned off, but type them in the question and answer, and we'll get to talking to you all about how you can become profitable in dental sleep. And I think this is, by the end of this webinar, you will find that this can be one of the most profitable things, and I'll venture to say the most profitable thing a general dentist can do for his or her time that they spend. And we'll explain why that is in just a little bit. I'm Dr. Guy Yatros. Welcome to this webinar. Thank you for taking the time. We promise this will be worth your time. My partner there, Rich Drake. I'm in Florida. Rich is out just in San Antonio tonight, I assume.
Yes. Yeah. Getting a little rain here, so it's kind of nice.
Well, all right.
Been awful dry.
We've been doing this for over 20 years independently, over 40 years between us. With all of our team at DS3, we have, I'll bet, pushing 100 years worth of experience in helping dentists produce dental sleep devices and help their patients with dental sleep. And so if you ever want to know more about what we're doing, we'll tell you about how we can help you at the end of this. You will get an hour CE for this. You got to stay for the entire time. And then we'll tell you that I'll be coming to your inbox within 48 hours. If you don't find it for some reason, contact us or check your spam first. And so we're going to get going right after we announce the next webinar. We're excited to do. I'm doing that with one of my other partners, Dr. Justin Elkofer. He works in our 3 sleep practices here in Florida, where we are exclusively dedicated to dental sleep. We have Dr. Mark Murphy and Lynn Liptak and Sung Kim from ProSomnus. We're going to talk about some new materials, some things that are changing how we adjust these devices, and we're going to talk a little bit too about some fast track titrations in that one coming up. So if you're interested, by all means, join us there. Before we get started on how we make money at this, I want to ask a poll, and I just ask you to participate in this. If you screen your adult patients for oral cancer, and here we go. I'm going to put this up here, and I'm going to launch this poll. Hopefully it'll work. And how many patients did you find who were at risk for having oral cancer last year in your practices that you went and sent to the oral surgeon or did a biopsy yourself? And I can't tell who's answering this here. And we're just going to kind of get an idea. We've got about half the people done this. Okay, I'll stop it right here and share this, just so we don't take all night with it. Here's the results. Pretty much what we would expect. We've got the majority of people, 37%. Did I share that? Yep, you can see that. At 1, some people at 2, 3, and some at 4 more. The most I've ever seen, Rich, with this is 6. I didn't ask it to that point, but maybe someone can put in the Q&A if it was above 6. I'd be interested to hear that. But that's pretty, I'm going to stop sharing this so it gets off the screen. That's pretty understandable, because in the adult population, about 1 in 1,000 adults have some oral cancer. And if you have 1,000 patients in your practice, adults, that's right on the money that we're doing our jobs there. What I want everyone to think about is why we do this. And if this was a live course, we could sit down and talk about all the reasons, but what's one of the most common things you hear, Rich, when we ask that live? Why do you screen for oral cancer?
Either I was taught to do it that way, or, it certainly seems like the right thing to do, as a dentist.
Yep. Don't want to get sued. It's my job to do this. It's in the mouth. A lot of reasons like that we talk about. Well, if we're going to talk about profitability in dental sleep, we want to talk about, is there people that need your help out there? I mean, if we're going to solve something, is there a need for this? And so I'm going to ask, for those of you out there who actually have dabbled or do some sleep apnea in your office, how many of you have found people you found at risk last month? And if you haven't done anything about dental sleep, then you don't have to answer this. But if there's anybody out there who's actually doing this, and if you're actually screening your adult patients, how many did you find last month? And I had to change it from a year, and you'll understand why in just a few moments. So we may not have quite as many respondents here, but I always find this extremely interesting. And if you'll just remember what we're talking about here, you're going to see there's plenty of profit to be had in dental sleep. So we've got almost the same number of people here, right at the same number. So I'm going to end that. And look at here. I'll share. I think that's showing up. You see that, Rich?
Yeah.
That's 61% versus for 4 or more versus 1 was where we are with oral cancer. And you can see the vast majority have, and this is per month. So, you just think about that. That's 12 times more people, because if I said it per year, it would all be 4 or more if they're doing any decent job at all of screening this. And the reason is, I'll stop sharing that to get it off everybody's screen, is because the prevalence is so much higher. 1 in 5 adults in our country has obstructive sleep apnea. That doesn't even count the people who just snore and still have issues. Those are closer to 1 out of 2. So 1 in 5 of the adult patients walking around in your practice, getting their teeth clean, getting periodontal treatment, getting a 2-surface composite, whatever they're getting, they also have obstructive sleep apnea. And most of them, 85% or more, don't know they have it. And of those that know they have it, they aren't treated successfully in most cases we're going to talk about tonight. So is there an economic opportunity here? I mean, look at the numbers there. How many dentists are actually doing this? We're going to talk about that in a little while too. Is it a good time to get involved in this from a financial point of view, as well as are there systems in place that are making this easier for dentists? So I did a lot of talking. Rich, you have anything more to add before we talk about the ADA here?
No, but I will say I remember that day, Guy, because it's October 23rd, which happens to be my anniversary. So I was married a long time ago, but in 2017 is when this came out. And, it says basically we should be screening our patients. And, it's amazing that we get in front of thousands of dentists every year. And most dentists don't even know this,
Right.
so I was happy to see that, when you did the poll, Guy, that a number of them are screening and they're finding more than 1 a week. The majority of them were finding 4 or more in a month. So, we hear a lot of times, we hear our dentists, say, well, where do I get the patients? Where do the patients come from? And we have to remind them that they're walking through their doors every day. Just like you said, Guy, people are coming in to get their teeth cleaned, whatever, we're working and living in their mouths. We can see their airway. We can do that. So, hopefully this will change.
Yeah, and I think this was a big step in the right direction, because this is a message we've been preaching for a long time. And I've shortened the message, Rich, to say it's your job as a dentist to screen patients, to look at them and assess their airway and say, are they at risk for having obstructive sleep apnea? And prior to 2017, I didn't have a whole lot to back that up other than maybe my opinion or maybe the AADSM's opinion. But now, as of 2017, rather, 3 years ago, a little over 3 years ago, the position is that dentists are in the best position to really look at these patients and see who's at risk. And it should be part of their job. I'm just paraphrasing this, but I think when you think of it that way, it's my job to talk to them about this and to say, hey, you may have airway problems, and to get them to someone to help get a diagnosis. And then it's our job to help treat them if they have apnea and they're appropriate candidates for this. And we should follow up with sleep testing devices to make sure these are working. We'll talk more about that in our next webinar and a little bit briefly later on. But it's our job to do that now. And once we embrace that, it becomes pretty easy to find this to be financially lucrative, because there's so much need for this out there. So many patients that need our help. So if you have any questions, put them in the Q&A and just type them in that, and we'll answer that. I see some stuff coming in the chat. We could check that as well, but the Q&A is the best place for us to have questions. We will get to all your questions before the night's over. If you have them, we'll stay on, or at least I will. I don't know what Rich's schedule is, but we'll stay on until they're all answered. Have you ever heard this, Rich? When you go to how many doctors do you see a week? Or before COVID, you were seeing a lot more. But
yeah, I mean, we do a lot of lunch and learns in my office. We found that's certainly the best way to, establish a strong referral source in your community. It takes a while and it takes a lot of work, but every time I hear this, Guy,
Yeah.
What do you mean dental devices? What do you do? You know, well, insurance doesn't cover them. Well, yeah, they do. You know, you hear the same thing over and over and over again. And it's just, you know, I think it's my job to go out there and I tell my staff, we educate these doctors one at a time. That's the only way I know how to do it, because I can't get them all in the same room, you know, to teach them something or do something. But you know, this is what so many of them were taught, and that's what they still believe. And they may not have a dentist in their community who does this, so we can't even fault them that much for this, you know, because it's our job as dentists to get out there and educate them and tell them what we can do for their patients.
And this isn't the standard, and this is not true, by the way. And it's our job to do what Rich is doing, is to get out there once you're educated on this. So talk to your doctors about it. They're, like I said, they're not bad people. They're just uninformed. And if we can help inform that how well dental devices work, we can shift this scale in our direction. And again, there's so many people that need our help out there. We just got to make them aware. And to think CPAP works better, if they were still alive, you could ask these two people. It didn't work for them. Carrie Fisher, you all know from Star Wars, Judge Galila, both of them had CPAP, and both of them weren't wearing it the nights that they died. I have a personal story that if you've heard me talk before, you've probably heard about this. The fire chief in Manatee County I was introduced to quite a few years ago, and saw him in the gym all the time. He came up to me one day and says, you know, I can't wear my CPAP. And I don't know what else to do, but I saw you had a sign on the back of your car about you know, it's helping people with sleep apnea. What do you do? I said, come in and see me. We'll give you a free consultation. Within a week, he never came in. He was dead. He was in the paper. I was just shocked. Talked to the guy, and within a week, he died and had surgeries, and you know, never had an opportunity to look for an alternative treatment because he was unaware of options. And that's just a shame, really, folks, that we have an opportunity to fix this and to help this, and we have an opportunity to financially gain while we're helping people. So what a win it is. It's a win for the patients. It's a win for us. And it's a win for the medical community at large that we can have a solution for doing this. And I think what you have to remember is breathing is important. And I think if we
It's
could
not
go back,
overrated, is it?
it's not overrated. I've got that slide coming up. But you know, if you were talking to Rob Rogers, I think in the last few days, who is one of the people that's been around dental sleep for as long as you have. And if I had a time machine that could change one thing about this, I think I wouldn't have called it dental sleep medicine. I think we should have called it dental breathing medicine or something. You know, this is
Yeah.
it happens when we're asleep, like bruxism does, but it's about breathing. And so when your patients go, well, you know, I sleep fine, I'm fine, I'm fine. Well, how about your breathing? Is it important to breathe? Because I tell you, there's nothing more important. If you have these people here and you could offer some all the, you know, you're going to be the new richest man in the world, or you're going to get this regulator with some air in it. At that point, what would you take? You would take the air, because it's the most important thing that we do. It's breathing is the most important, and that's what this is about. Yes, it affects the sleep, and yes, it happens in the sleep, but you're going to get some pushbacks from your patients going, oh, you know, I'm here to have my teeth clean. And yeah, sleeping, that's not, I don't know, buy into the hype about sleeping. Well, what about breathing? How do you feel about that? Do you like it? Are you addicted to that or not? You know, and if so, you need to listen to what we have to say, because as a dentist, you truly have an option here to change what you're doing, from saving teeth to saving lives. And actually, you can even really do both if you understand the airway. We could talk about how it affects dentistry for hours. That's not the point of this conversation. This conversation is to talk about the opportunity for dentists to get involved in something that is going to be some of the most meaningful things you'll ever do. And if done correctly, can be the most financially lucrative while helping your patients live better and live longer. How cool is that? And it starts with doing your job. Every dentist should be screening their patients. I think if you let a patient walk out your door who has hypertension and big neck and snores and all the things that you should be looking for, and you don't have a discussion with them about having a sleep test, and that patient falls asleep and dies at the wheel or has a heart attack in the middle of the night, you should feel bad. You didn't do your job. Your job was to at least have a discussion with them. And furthermore, your job's really to get them motivated to go get this looked at. So
I wonder, Guy, you know, when you think about I had an old guy in dental school, and Guy and I are both a little bit old. Well, you know, I still had to do a gold foil on my state board in Texas. Tells you how long I've been doing dentistry. But you know, the one old guy said, you know, I used to have to hold the tooth with the back end of the mirror handle to prep it for a crown, you know, because it was so periodontally involved. And you know, we laugh at that, but I honestly think, Guy, 10 years from now, 20 years from now, we're going to look back at the way we viewed this as dentists as the same, in the same light. You know, we'll think, wow, that was archaic. What do you mean dentists didn't, you know? And now you know, you think, holy cow, you know, not all of us have to do perio surgery.
No.
But by gosh, it's our job to you know, at least screen for that and refer appropriately. And somehow we've got to get the airway up there commensurate with that, because it's even more important.
I think when we become as adamant about doing airway screenings as we do oral cancer, when we believe it's our job just as much, and we're just as remiss if we don't do it, it's going to change the country, and we're going to see this problem, the needle, moving a great deal. And I'll say it in a negative way. Unless you do that, you're going to have challenges in dental sleep medicine, dental airway, whatever we want to call this, because you're not going to be vested or believe in what you're doing. So that's kind of an aside we could talk about forever. But if you get over that hump and you believe this is my job, and you don't think you're just trying to sell your patient something, this can be one of the most profitable things in dentistry while you're helping your patients breathe better, sleep better, and live longer. And the reason is we have limitations as a dentist. Okay. I mean, yes, you could go start a bunch of clinics and things like that, but that's not being a dentist. You're a business owner at that point. But as a dentist, what do we have in common, everybody on this screen here? We're doing something with our hands. We're a laborer of sort. Whether you're digging dirt, flying a plane, driving a truck, being a dentist, or being a surgeon, you make money while you are doing only what you can do. And lots of dentistry requires the majority of the time, or at least half the time, the dentist. And why this can be one of the most profitable things you can do is because most of the time that you're going to spend with these patients can be done by team members if you do it effectively. And so therefore, you can produce more per hour of dentist time. So I would ask you to be thinking about, and we're going to kind of bring this full circle here at the end, but how much is you, if you're a dentist out there, how much is your time worth? If you're going to sit down in a procedure or a consultation or do whatever you're doing, your time's worth something. And if it's only you can be doing that, how much is it worth? And we can look at things like common fees. I pulled these off the ADA's website this weekend, Rich. So these are fees for an all porcelain crown, $13.86. I don't know how much time it takes everybody to do those. It's been 7 years since I've done general dentistry. I put in some times. It used to take me an hour from start to finish with a seat. I was pretty fast at doing that. But think about your times there. How much are you making per hour of dentist time? If you're doing a 2-surface composite, 20 minutes is, I think, pretty smoking on 2-surface composite. That was harder to me than doing a crown back in the day. Root canal, put your own numbers in there, and take out a piece of paper now and kind of scribble some of the things that you do and how much of your time are you spending, if you're the dentist, on those procedures, and how much are you making per your hour time? And if it's a crown and it's not an all porcelain, I picked here as like a CAD cam crown. If it's a crown you're sending off, there's a lab bill, you need to subtract the lab bill out and then say how much time it is. And we're going to look at that compared to dental sleep in just a little bit and show you how this can be extremely profitable. And Rich and I have been doing this for 20 years, and some things have made this much more feasible in 2021 than they have been in the past. I'll preach to you all like I do my 14-year-old son now. You don't know how good you've got it, because we have really changed a lot of things, even though it's been a lot of hard work to make this easier for dentists. I think it all started in 2006, at least for me, when the American Academy of Sleep Medicine, so the AASM, not the dentist, but the American Academy of Sleep Medicine, prior to 2006, if you had sleep apnea and you were given a CPAP, or you went and got surgery or some other things, dental devices weren't really recommended. And in 2006, that changed. So it's been a long time, folks. 2014, it changed to say that dental devices are considered for patients who are mild to moderate as a first line of therapy. And anybody who has severe can't wear CPAP, dental devices should be your choice. And they should be completed by a dentist. So this ball started rolling for me personally in 2006. And what I did in 2006 was two things. Well, three things. It's about the time I met this good buddy of mine who used to fish a lot, and now he works too much, Rich Drake. That's about the time I met you. I hired a sleep person to really just do that part of my practice. And I did some branding for sleep. Those three things changed from 2006 to where I sit here today doing just dental sleep. And it really changed by 2013 when I sold my office. So in 7 years, those decisions, and we're going to talk about those decisions in just a few moments, but the parameters now are even more in dentist favors we can talk about. So Rich, you were already doing some dental sleep, mostly. That's all you were doing at the time. How did this affect your insurance reimbursements and things like that when all this first came out?
Well, we didn't even have a code we could bill for back then, Guy.
Right.
You know, I mean, there's just been so much research that's been done in the last 15 to 20 years. You know, back then, Guy, it was like, I'm not so sure those dental devices work. You know, and now it's not a question of whether or not they work. No, do they work for everybody? No. But do they work for most patients? Yes, they do. That's not a question anymore. And then we have a code that we could actually bill for. So, you know, we're seeing this, you know, we're chipping away at this. And most people would tell you it takes 20 to 30 years to change how we view something and how we actually diagnose it and treat it. What year are we in that 30-year process? Nobody knows for sure, but I think this is where a lot of this started, guys. So if that was 14 years ago, maybe we're about halfway through that. So you younger guys and gals out there, you know, you just look at me and you go, yeah, the first guy through the wall always gets bloody, you know. And it was hard back then because, you know, we were trying to convince these doctors to refer us, and they were like, well, there really isn't that much stuff that even says this works. So the AASM, which is the medical side, has done this in 2006. They updated it again in 15. Even the Academy of Dental Sleep Medicine is now saying, you know, hey, as dentists, we should be allowed to order sleep tests and do this. So we're seeing this change from, you know, it was managed and run 100% by pulmonologists for the most part, sleep docs. And now we're seeing more auxiliary people getting involved, and we're seeing, you know, dentists getting more involved. And Guy and I started Dental Sleep Solutions 9 years ago just to help dentists do this. You know, that's what we do. And that's why we're giving you this webinar for free tonight, you know, when we think about doing this. But you're right, Guy, a lot of this started when this came out.
And for those of you who've never watched a video of someone having apnea, tell me what is more important for you as a dentist, that this guy was your crown patient, than to let him know that he might be at risk for this, and then once you find out he has this problem, to help him treat it. I mean, because it's not a complicated thing. Basically, he's breathing, and now he quit breathing, or very low breathing. What's happening? Well, he has a cork in his throat there. His airway is narrowing, and he's struggling to breathe. And Rich taught this. Look at his heart rate. I bet his heart rate's going through the roof. His chest is going up and down. And he has to make a decision. His body has to choose between sleeping and breathing, because he's trying to get that restful sleep. No air going through. He's going to make a decision. It came out of deep sleep to lighter sleep, to take some breaths, and the whole thing is going to start over again in these patients. And we could spend an hour talking about the pathophysiology of this. Essentially,
that's not true, Guy. We could spend 10 hours talking about
we could
spend about an hour on every one of those things, but that's what's happening. You know, your big old fat tongue falls back there and gets in the way, and you, like you said, Guy, you got to choose. You know, do I want to sleep or do I want to breathe? Well, oxygen wins most of the time, and there's that tongue. You got to play that one more time. Everybody watch that big old fat tongue in there. It looks like a tennis ball. And you know, when our jaw falls down and back, you know, our tongue rests against the back of our throat. I mean, some of us, Guy, you know, certainly as you get older, you know, I think some of us can say, yeah, I'm a patient, or I'm a potential patient. Guy and I both wear dental sleep devices. We both, get the elbow when we're not wearing it. Hey, my wife calls it my dental thing. She says, hey, put your dental thing in, because you're snoring again. But that's, and that's our territory, I think, Guy, when you look at that tongue.
Yeah. And yeah, I'm going to emphasize that too, Rich. Like you said, who else should be talking to these patients about this if it's not us? I mean, there's no one else that's in that area that meets these people, that interacts with them. You're working on the crowns, that tongue's in your way, that you can assess this. And we could spend, we've done webinars for 2 hours just on screening, so we could go into detail on it, but suffice it to say, this should be our problem. But who's right now, most people, 85% of people have that happen, don't even know it's happening, or undiagnosed, and we need to help them. And what kind of effects can it have on you? We could show you a bunch of studies. I kind of like this one just because it's simple to understand. It's what's the risk of having a heart attack? If you take a standard healthy person of 1, and then you take someone who's overweight, well, we all know that's kind of bad for you. 7 times more likely. I don't think anybody's going to be shocked at that. What about if you have hypertension? Think about it in your head before I advance the slide, but I think most people would probably guess somewhere in that neighborhood. What about smoking? Gosh, we know that leads to heart attacks and amongst a bunch of other stuff we don't want. We know how bad that is for you. What do you think the risk factor for a heart attack for smoking? Well, it's 11. Okay, I think that seems about right. Where does OSA apnea fall into this study? And would you believe it's over double that of smoking? This stuff is terrible for you, and I think it's widely undiagnosed because it's so common.
Yeah.
Everybody's overweight. So we just say, okay, well, everybody just leave them alone. That's just the way the world is. I can remember a day when that's the way it was about periodontal disease, like you with the holding that tooth in place, that it was so common. Everybody just thought, well, there's nothing we can do about it. We'll just ignore it. And I'm telling you, we can't ignore this. And there are great solutions. I am confident if I didn't have my dental device, I would have way more health problems than I do. I don't, knock on wood, have any health problems. And I think it's a big part that I sleep well. And these are all, we could spend a day on this, are all the things that can be related to untreated sleep apnea. I don't have to read them to you. They all can directly be related. We can, hire people that know more about it than us, can give you a lecture on exactly why. I know some of the reasons, but everything on that screen can be related to this. And do you want any of this stuff in your own life if you can prevent it? I mean, why would you want that? If I will take a quote from the late Pete Dawson, he once told me, he said, Guy, just keep in mind, every reasonable person wants a healthy mouth. When you go do your exam, that no one wants decay and have fractions and malocclusions and all that kind of thing. Well, I think I could take Pete's saying and say every reasonable person doesn't want any of this stuff. I mean, they may say they don't care if they're in denial. No one wants to have a heart attack. No one wants to have diabetes. No one wants to have cancer or automobile accidents. No one wants this stuff. So, and most people, if they realize they're at risk for that, will choose to try to do something about it. And here's where the economic things come in for us, folks. There are only, in today's world, the American Academy of Sleep Medicine recommends 2 first line of therapy treatments for obstructive sleep apnea. We're going to go over the numbers of the amount of people that have that. What are they? Well, everybody knows it's the CPAP, but it's not surgery. It's not Inspire. It's not by a laser. Yeah, not by a laser. It's a dental device. I mean, if you're writing things down, a little cheat sheet, like I often ask people to do, write that down. 2 treatment options for OSA. This is it for the first line of therapy. Yes, if neither one of these work, there's other things we try to do, like surgeries and weight loss and Inspire and lots of other things. And there's adjunctive things we can do, like positional therapy. But those 2 things are the treatments out there. Now, the problem is most people aren't aware that dental sleep devices are even out there. And furthermore, they're not aware that they are first line of therapy. That a lot of people think, well, if you can't wear a CPAP, they're way down on the list. It's something you could try, 5 things down the list. And that's not true. It's not Guy's opinion, not Rich's opinion. It's the American Academy of Sleep Medicine's opinion. So let's talk about these 2 things. So you've got all these patients that have this problem, and they have 2 choices. One is a CPAP. Okay, how does CPAP work? Put a mask in her nose or face, and it blows it open. It's a pump. I keep meaning to get a CPAP and hook it to I think I'm gonna put it on a glove, Rich, and just turn it on. It'll just blow the glove up like, Howie Mandel used to do back 100 years ago in his stand-up act, right? It's just going to blow the balloon up. That's how the CPAP works. It works pretty well. You get a good seal on here, and this airway's collapsing. It pressurizes the airway, and it opens everything up. It's why it's called continuous positive air pressure, and it works. And if it works so dang on well, why are we spending our Tuesday evening talking about it? One caveat.
Yeah, people don't want to wear it.
You got to wear it. And compliance rates, depends on who you ask about the compliance rates, but long-term compliance rates, what do you want to say? Something conservative, Rich? 50% at best? Is that a more than fair statement?
Yeah, I think that's being generous. I think, part of that depends too, Guy, on, if you do a drive-by, and they throw the CPAP machine in your back seat, and they say, hey, good luck, I mean, and not all the docs do that. Some of them work with them. Some of them have little clinics where they can come in and they can fit their mask better. And they have groups where they talk about, how to get used to it and things like that. But so you can be better or worse at that. And I believe that's true for dental devices too, Guy. I would caution you, we're talking about how to make this, profitable, and that it can be profitable, but you have to pay attention to these people. You can't just give them a dental device and, look the other way. You have to continue to see them and follow up. And as I'm letting the cat out of the bag here a little bit, Guy, but we can train, our assistants to do so much of this. That's why it doesn't take that much time. And I will tell you, that doesn't happen overnight. No. We have 4 assistants, in my offices, and we work very hard every single day. I take them aside and I say, hey, look at this note, look at what you did. Look at what you said. Look, we're just constantly training them. But, I wish, Guy, in a lot of ways, if we were older, we might have been sitting there when they were figuring out what sleep apnea was. And if you and I had been sitting there and we said, hey, Guy, what do you think? And you go, we just grab their jaw and pull it forward. I think maybe we'd have 95% of the market share, and CPAP would be struggling to get, more of it if we'd come out with it first. And the reality is, when we think about how much of the market share we should have, there are countries in Europe where it's more than 50% already. So I think if you give patients a choice, and then you have trained dentists who are doing this well, and this is why, when you go through this little equation here, I love this.
Yeah. And you can plug in your own numbers here, and we kind of beat up on CPAP, but to be clear, CPAP works great for the people it works for. Just long-term compliance for people to wear it every night, all night long is not where it needs to be, or we wouldn't be having this conversation if it was. And so let's say that people only wear it half the time, or half the people wear it all the time. I don't care how you want to look at it. It's 50% compliance, but it's 100% efficacy, which we're giving them the benefit of the doubt that it's always going to open up the airway. So that's overall treatment effectiveness of 50%. But if our dental devices are not quite as much efficacy, but they wear it most every night, then we've got 20% better in this scenario. And, this isn't true for every patient, but to think CPAP always works better is just not true, because a lot of people don't wear it. And dental devices sometimes don't work as well, but people wear them. And many times they work just as well. And so when you weigh these things out, the new standards are that dental devices and CPAP are both first line of therapy treatments for obstructive sleep apnea. And the problem really boils down to there's less than 10 people out of 100. I'll raise this up a little bit just to even say, 85% don't even know they have it. Think about half of those people aren't successfully treated. Do you think there's a financial opportunity for us here when less than 10% of the people, I don't think anybody's going to argue that less than 10% of people are successfully treated who have apnea? Because again, most of them don't even know they have it. And when they do, they're not wearing their CPAP, or they didn't get to a dentist. Think about the economic opportunity. And in 2015, the AASM, American Academy of Sleep Medicine, the AADSM came back together and study this again, and they found that the data is showing up to 83% of the patients are non-adherent, and that therefore dental devices when it comes to them, to the mean disease alleviation calculation. I just like saying that to feel kind of important. You know, of oral appliances may be comparable. So in other words, you know, you called, I think, apnea load or something, right, Rich? I mean, it takes the number of apnea events down equally when you consider the compliance and efficacy of the two frontline.
Yeah, think back to that slide you had before, Guy, where you said
Yeah.
no reasonable person would want all of these things. And, you know,
Right.
it's that apnea load, you know, in a nutshell, that's really driving all of those negative things, you know, and all of those things that are happening. So,
Right. And this is, you know, pretty hot off the presses about a year ago. 54 million Americans. So if you look up here in the top left, you can see all different countries here. 24 million with moderate to severe in our country are affected. 54 million. So this isn't Guy and Rich's opinion. That's a huge number. And if you take that number and just say, how many dentists are there out there, just for fun? I went to the ADA's website and they said we have 164,000 practicing dentists in the U.S. So I pulled that off the website over the weekend. So that's where I got that number. So that's 333 patients per dentist. Now, they don't all need dental devices. Okay. Some of them need CPAP. There's still a lot of work to be done if that was the real math. But the truth of the matter is there's less than 10,000 dentists in the country doing any amount of dental sleep. I probably could readily put 5,000 or 3,000 into this equation because last time I talked to anybody at the AASM, they had under 5,000 members. You think that's still true, probably, Rich?
probably.
Somewhere in that neighborhood. American Academy of Dental Sleep Medicine. So this is an organization a lot of people join if they're, you know, going to be involved in this. Talking to our friends in the industry, I think 10,000 dentists are even doing a minimal amount of this to the ones doing a lot. That's a good number to put in there. So that's 5,400 potential OSA patients per dentist that are actually doing this today. You know, even if double that happens tomorrow, we still don't have enough to service all these OSA patients. And OSA is becoming worse. Okay, more and more people are getting it. So the numbers are going up. And so we need your help to do this. The numbers are there for us to do this. And you should do this because it's your job and it's the right thing to do. And at the very least, the screening of the patients. I think once you go through the hurdles of learning how to do this, then there are some hurdles we're going to talk about in just a moment. You'll find it's really, you join this for the profitability. I think you'll continue to do it because of how enjoyable of a service it is to help these people who are struggling to breathe and sleep at night.
It's meaningful work. What I like to say, Guy.
Right. See someone's got their hand raised. If you have a question, we don't have a way. This is a webinar, not a meeting, so we can't unmute you. But you can put anything in the Q&A you want. We're going to talk to you about some opportunities about learning more about this in a little bit and how we can help you at Dental Sleep Solutions. If you ever want just a free consultation with us, our team members will meet with you. You just type in consult along the way and we'll help you with that. But if you have questions, please put them in the Q&A. I know Rich has been answering a lot of them as we go through here with you. I think, so we're going to talk at a high level for about 10 minutes about what you need to do this in your practice, because that's part of what you have to understand if you want to be profitable. If you want to know more about all these moving parts, we're going to talk about courses we teach and so forth, where we go into detail, and you'll have the information you need to move forward. Because there's nothing particularly difficult about dental sleep each step, but there's just a lot of pieces to it. And if one of the pieces are broken, you're going to find yourself struggling. So it's just an orchestrated set of events that we can help you do. At a high level, we're going to break it down in what we call the 4 pillars: screening, testing, treating, and billing. If you can have systems and team members in your offices to do those procedures, most of which can be done by non-dentist personnel, it doesn't have to be the dentists themselves, you're going to find that you can help a lot of people and be profitable while doing it, because there's millions of people that have this problem. When you're screening, we could, again, spend 3 days talking about these things here as well. I'll leave it on there for a second. You might want to take a screenshot. These patients, anybody that has these red flags, even one of them, certainly more than one, your job as a dentist is to start talking to them about that they may have an airway problem and that they really need to get somewhere and get a sleep test. So it's your job to do that. So if they even just have one check mark, it's enough for me to want to have a conversation. Certainly if they have 2 or 3 or 4 or 5 of the check marks on here for that. We'll talk about a system we have to do that with in just a second. Rich, do you have any more to comment? Because pretty important what we're talking about here?
No, we tell guys, we tell you, hey, take a screenshot of that. You just look at that medical history or the slide that we had up, and we do record these, by the way, so you can watch them, at a later time. You just took a picture of that and you put it up in your dental operatories.
Right.
People, go, what is that up there for? Do you have any of those? We're looking for ways to start this conversation, with our patients, and this is certainly one way to do it.
Yeah. And we have ways of doing this with the software that we have that we've spent the last 9 years developing. We have a screening application that's really slick, makes your job easier. It helps the patient interact where they can see, oh, I'm at severe risk. It helps with conversations. But we also, through our DS3 training, we teach you how to have the conversations when the screener comes out like this, and the patient's holding this tablet in their hand, or you're using a computer in the operatory, or we even have a screening application you're going to be able to put on your website shortly. We'll teach you how to have those conversations. But at the end of the day, you need to have a way to look at their patients and assess their susceptibility to OSA. ADA says we need to be doing it. It makes common sense that you should be doing it because it's in your area. And I think sooner or later, a dentist is going to get sued for not doing it. And I think that's when probably everybody will start, unfortunately, doing it, but maybe get ahead of the ball and start doing the right thing first, because it's our job to do that. No one else is in a better position to do that.
And I want to add to that too, Guy, that we have done hour-long webinars just on screening. When you think about that, so you can check out our YouTube channel where we've got a bunch of these things recorded. But we're moving along now. We're going to screen. We got to figure out a way to get these people tested, and you got to have a what, Guy? Got to have a plan, but what are our options? You can do an in-lab test, or you can do home sleep testing. And when my kids were young, Guy, I used to, you don't say, do you want to eat your vegetables? Because
Right.
of course they're going to say no. You say, well, which do you want to eat, the carrots or the broccoli? And that's kind of what we do. When you said we have these screening apps and you do this and it says I'm at severe risk, well, you want the patient to say severe risk for what? For sleep apnea. Well, we'll talk about that while we're cleaning your teeth today. You want to get them engaged in this and doing that. And we ask the same kind of thing. Well, what do I do about it? Well, we need to get it just sleep tested. You can do it in a lab or you can do it at home. Which would you prefer? What's that same kind of thinking?
And back to, you don't know how good you've got it. For those of you, if this is one of your first sleep webinars, this wasn't an option until 2017. We only had in-lab sleep tests. And not only wasn't an option, things have gotten a lot easier and less expensive. So one of the questions comes up is, which is more accurate? Well, no sleep test is 100% accurate. It's the bad news. But one in the lab, it might have some more signal, so it could be a more accurate test, but you're not going to sleep as normally. And at home, there's a possibility we don't have as many signals, although the tests have gotten so much better that may not even be true. But we're going to have a more accurate night's sleep at home. And one of the things I think almost always people get wrong, or are kind of new to this, is it's kind of counterintuitive. If you don't sleep well, do you think you'll have more or less apnea? Most people say, oh, if you don't sleep well, you're going to have more apnea. That's just what usually comes out. But it's the opposite. If you don't sleep well, you're going to have less apnea because you're not going to get to the deep stages of sleep where the airway becomes relaxed, and you and you have more apnea. So I don't think that HST is any less accurate at all. And really, it's the way to go these days. Again, we're just giving you kind of an overview. We have ways of ordering home sleep tests through our software. We have partners we can work with that do telemedicine. The tests will come back into our software with all the stuff that you need. So this hurdle that used to be way up here has gotten a lot lower. And we even have a sleep test now that you can use, which we really ideally use it to evaluate how effective our devices are. It's that big. That's it. So you can purchase these things for under $100 to actually see how well your devices work, and the patient gets to keep it. It'll last for 3 years. And it's actually a sleep test, not just a pulse oximeter. Here's a website where you can get those at. If you stay on, we'll tell you how you can get one of those for free at the end of the night here in just about 10 minutes. So again, like Rich said,
they hold 100 hours worth of data too, Guy. I think back to the first Rimmers recorder I bought. I think I paid $15,000 for it, and it won't even hold 2 nights of data. So
right.
We've come a long ways. But
yes, yeah, we have. And treating, this used to kind of be like, what do I do now? we break this down into steps, screening, testing, and then we have pre-authorizations and consultations, exams or scans that we do today. It's a little different. We deliver the device, and we have follow-up testing. Again, we can use one of these things for that now. And then we need to see our patients at least once a year, maybe at 6 months to start with. And so those are the appointments you need. And as you're looking at those, think about how much dentist time for those. And there's state laws that come into effect, but I'm going to talk about that in just a few minutes. And most of these appointments can be done by auxiliaries if you have a system to do that with. We have a system we can, if you want to know more about, let us type in consult along the way, and we'll meet with you about how we can put all those pieces together and how we can train your team on how to do this, and even how you can get billing done. This used to be the biggest hurdle in dental sleep because there was no one to help us with it. Rich, when I met you, I'm like, how to do the billing? Well, you got to figure it out. And my team taught, my hygienist became a dental medical billing, a dental sleep medical billing expert by talking to your people and calling other people across the country and figuring out these systems. And you don't have to do that now. Now there are companies that do medical billing for dentists, in particular do medical billing for dentists doing dental sleep. And so you don't have to recreate the wheel. Once again, you don't know how good you have it because you don't have to go out and do this. If you want to, sure, do what you get really busy and want to take the billing in yourself, then do it. But for now, you don't have to do that. And we have a way to do this all digitally through clicks of buttons that you don't have to be calling people on the phone. And so you can concentrate on what you're doing in your own office. So those 4 pillars, just want to kind of give an overview. We'll be doing more webinars throughout the year where we'll probably talking about each of those pillars more in detail. We, in our training, our virtual courses, we go way into detail on them. But back to this question, I can tell you 20 years ago, these steps, yeah, they took me an hour or 2 of my time because we had no systems to do this. We didn't have anything, any efficiencies. We didn't have team members trained to do this. But now we have a training system where we train your team to do what they need to do. You as a dentist really, at least in Florida here, the impressions are done in scans. So I don't even do that part anymore. And I spent a little bit of time on the consult and delivery. A conservative approach by our offices that we train, after they've been trained and done a few cases under their belt, you should not spend, you should spend less than an hour, 45 minutes or less of your time to do a patient from start to finish. Now, there's a lot of time on other things, but your teams are doing that time. Not a lot, but things are happening during these appointments. But look at the things on here. This, I don't see obturating root canal on here anywhere. Do you, Rich? I don't see anesthesia on here anywhere. Do you? I don't see, cutting the DO prep on here anywhere. Everything that's on here is talking to patients mostly, communication, writing. And if you get team members to do this, how much of your time to plug into this formula? Under an hour. 45 minutes is very obtainable if you have your offices. And I can tell you, I know in my office, I spend less than, when I was running my dental office in particular at the same time as my sleep, 30 minutes was the average. Some people threw the average off because there's those patients that you're not immune to them in dental sleep either. But that was really what we strove for. But we'll put 45 minutes here. And the reason I put 2,000, because let's say you got to, pay someone to help with the insurance, you got a $350 lab bill or something like that. So subtract that out first. And I think 2,500 is a pretty conservative amount. We average more than that in my practice personally. So that's after the lab bill. We're making double what we're making on any of these other procedures per hour of dentist time. And I don't know what else you can do as a dentist that's that profitable, because you can't delegate most of these procedures here. Because as a dentist, and I've had this conversation and no one's come up to me. I had one person say, well, if you're doing Invisalign and, orthodontics, yeah, orthodontists, they do a lot of delegating too. That's one of the reasons they're more profitable than general dentistry. But I don't know if too many people of general dentists have got an Invisalign only practice out there. And we know a lot of dentists who are out there doing this in their practices and really gravitating towards it. So those are the numbers. You can make double the amount of time as a dentist, but you're going to have to find a way to do this, because this is what a busy dental office tends to look like, right? Look at the dentist doing everything here, right? How are we going to do this? I told you I did 3 things to turn my practice from 2006 to where it is today, to where we have 3 offices just doing sleep. And most of that happened in 7 years. They were meet Rich Drake. Now, you just met Rich Drake, so you can check that one off on your list. And Rich, we'll be around to help you with stuff. I did some branding. I came up with Dental Sleep Solutions at the time was the name of my practice, which we now converted to our product and a company that helps you all. And I hired a sleep ambassador. I didn't call it that at the time, but we kind of coined this term. I hired someone to just help me do this in my practice. And well, actually, she was already working for me, and she was really not the greatest assistant in the world. So, and if any of you know Brandy, she knows I tell that story. And she couldn't pack cord or make temporaries, but man, she was good at some of the things you see on the screen. She's organized, could write letters, could talk to patients. And it's a lot of administrative things that she was really good at doing. And so she took over that part of my practice, and that became her sole job. And I ask you, if you hired someone to just do this part of your practice, say, all right, I'm gonna write a check. I'm gonna take a risk here, however much that costs you. How many devices do you think that they could do a week? If that's their only job in the practice. And 1 in 5 of your adults have this problem out there. 54 million Americans have this problem. Just think of it in your head. I'm gonna give you some scenarios here. If they just did 1 a week and you're making 2,000 a patient, which again, those are very conservative, that's still 6 figures. That's with 2 weeks off. If she wants a 2-week vacation because she negotiated that, or he negotiated that with their deal, right? What if they did 2? What about if they did 3? Look at the numbers that you can add to your practice. Okay, you got to subtract out that person's salary, but more realistically, we're going to probably get somewhere above that number. And if we do, look how that changes it. And I didn't go down to 4, 5, 6 a week. I mean, I just made very conservative numbers here. Tell me what else you can do in your practice to be more profitable per hour of dentist time. You can type it in the chat if we're wrong, or not in the chat, in the Q&A if I'm wrong on this. Rich, do you have anything to add about that other than how we can help them?
I don't know. I love your little thing on that slide there, guy. Just do the math. I mean, it's just do the math. I mean, dental sleep has its its obstacles to doing some of the questions, guy, or how come we don't do more of this, and things like that. And I typed in an answer there, but again, you don't have to reinvent the wheel. When Guy and I started doing this 20 years ago, we didn't have anybody to call. There weren't any webinars. If there was one, you certainly didn't do it for free. You had to pay so much for a lot of this stuff. But and sleep is still a small world, but it is growing. Most people believe that the curve is going straight up like that. And I would just tell you, as a dentist, especially, if you're younger, at DS3, we have how many now, guys? 7 or 8 dentists who graduated from dental school, and they never picked up a handpiece.
Right.
They've done sleep and only sleep from day one. So if you're younger, it certainly makes a lot of sense. But I think on the tail end, it makes a lot of sense as you get older too, because you can get an associate in, you can sell your practice, you can say, hey, I want to stay here, I want to just do sleep. Sleep is so much easier, Guy. You're not bending over, you're not drilling on people, you're not, I don't even think most dentists realize how stressed they are. When I quit doing general dentistry, I didn't think I was stressed, but 6 months later, I felt a whole lot better, because of that. So, it doesn't make sense, it makes a lot of sense, regardless of which end of the spectrum you're on, to get more involved in this.
Yeah, you told me that, Rich. And so again, I sold my dental practice in 2013, just to do sleep. And you're right. I was still stressed for 6 months. I just didn't know how to not be stressed. It is a lot of stress. And we're not recommending everybody go sell a dental practice. That'd be the worst thing we want out of this. But what we do want, if you understand there's a financial opportunity here, it does take some effort. And that's what we do, is help you with this through our training, support, software. I think people a lot of times ask, what do we do at Dental Sleep Solutions? What is DS3? Well, DS3 is a software that helps you be very efficient at doing this. But that's almost the product that you have to have, because you got to have a system to do this. What we deliver better than anybody else is all the training and support. We have a whole training continuum that you go through when you come on. We help train your team. We have webinars. We have just a whole myriad of support that we can help with all these hurdles to get these systems set up so this can run in the background of your practice. So if you want to know more about what we do, and even if even if you just want some help, you can type consultation in the Q&A, and we will meet with you. One of our team members will. They'll answer your questions. It's worth your time just to talk to these people, because they've been doing this for almost as long as Rich and I have, and it's getting a free consultation out of it, basically what it amounts to. And we can also talk to you about how we can make you more efficient at doing this. If you wanted to just learn more and come to a course, we're doing virtual courses now, and they're going really well. We limit them to about 30 people. This is done through webinar tonight. We actually do the courses. We open up the cameras, the microphones. It's like we're all in the same room. It's really, really well received. We had about 20 something people on in the last one we did. And if you want to come to that, we are discounting it from being at this meeting tonight to $299. And in addition, that's where you're going to get your free Night Owl Mini home sleep test. This test is good for up to 3 years, up to 100 hours. It's a level 4 sleep recorder, and up to 14 nights of testing. And we'll teach you how to use this Night Owl Mini during the course. So this is coming up. The date on here is February 2nd and 3rd from 7 Eastern to 9. I'll be teaching it myself. So type in, either scan the code in the top right, or sign up. I think the first 15 people get that, who mentioned that or sign up from this code, get the Night Owl Mini. But in addition to that, you can either attend the billing course if you just want to learn about billing from Lisa. It's on February, what does it say down there, Rich? My controls are coming. I think it's the 12th, isn't it?
12th, yeah.
Yeah, February 12th. And here's the deal. If you sign up for the virtual course, the 2-day course in February, you get to come to this one for free. So you get another 3 hours. That's 7 hours of CE that you get. We're doing the virtual course for the first time, and just in 2 nights, because we're going to make it a really packed, more condensed version of things we've done in the past. So, but you get to come to both if you sign up the virtual course, or you can just come to the billing course. So there's your codes for that. And everyone who comes to the virtual course will also get a marketing kit that includes a MyTap, a provisional device, another sample device on there, some brochures, folders. So just some things for you to get started with in dental sleep. So again, all that is included if you sign up for this course coming up February 2nd and 3rd. The courses are recorded, and you have access for you and your team for a month too. So you can even I'll view those later if you miss part of it, or if you want to share it all with your team. So what is a level 4 sleep recorder? Someone's asking. That is a sleep test that is conducted with peripheral arterial tomography, which is the PAT signal. So it's a special type of sleep recorder that is like the watch PAT. It's called a level 4 sleep recorder, to answer your question. And then our next webinar is on February 9th. We're real excited to talk. I've some of the newest technology in dental sleep. We're going to be talking about some new products, as well as how you use this device to fast track titrate your dental devices, as well as some other cool things. So we should be on that one on February 9th. So I think, look at that, Rich, right about on time here. Let's see if there's other questions. Again, I see someone said, what's just type in consultation if you want the consultation. One of our team will reach out to you and see what questions you have. They'll reach out to you ahead of time, asking what challenges you have, and then we can well, I didn't mean to do that. You know what I'll do? I'll put this back on this. They will schedule time to help you with those challenges. So put it back on here.
Yeah, and I would just encourage you guys, you don't have to reinvent the wheel. We have something to sell here, our DS3 software and that stuff, but we don't push that stuff real hard. I mean, our member support experts are very good at talking to you, and you just, in a few minutes, they can talk about, what your challenges are and give you a few things to work on. And, you just don't have to do this alone. I mean, Guy, I just see so many dentists struggle and struggle and struggle. And, That sleep ambassador, you guys think back to when Guy put that up there. He said, I finally hired a sleep ambassador. You just, you can get a really good employee in most parts of the country for $3,000 a month. And you just, I refuse to believe that that person can help you get one dental device a week.
Right.
By doing that, they're going out there and they're helping you market and they're helping you do that, and that's how people get started in this. But what happens is, you're the dentist, you're the business owner, you're the one trying to make all these decisions and do all that, and then you got your hands in somebody's mouth all day. It's very difficult to do. And I just see over and over again, guys, so many dentists that just, they don't want to reach out and get help from anybody for some reason or another. And I'm just telling you, you don't have to do that.
No, and if you want to do this, I can totally assure you, you're going to save. If your times, we started this conversation out about how much is a dentist time worth. Uh, if you want to go figure out what we figured out in the last 40 years between the two of us, and your time's worth that, then go do it. If not, let us help you with it, because we figured quite a few things out. I just typed in, someone asked best way to register for the February course. I put it in the answered it with the link. It's also in the chat box, or you can scan the QR code on your screen, and that's a way to do it. We do sell these out quite often, so we don't want to have this webinar like we're having here. We want to have it small group, so we limit it to about 30 people. So and certainly if you want the night, I'll register sooner than later. I know you'll enjoy it. It's 7 to 9 again on the 2nd and 3rd. So that answers that
Guy,
question.
I was thinking the other night, is there anything good that's come out of this last year, crazy year we've been involved in? And I think, maybe some of these virtual learning opportunities is something that's been good. I'm an old fashioned guy. I like to shake people's hands and look them in the face. But, we are all over the country, maybe even some people in different parts of the world. And we get to, interact and learn about this stuff sitting at home, drinking a cocktail or whatever we're doing. So, and the virtual courses, the education is just costs a lot less,
Oh,
and I would
geez.
encourage you guys to, you might not know if this is something you really want to do or not. Hopefully we've kicked you in the rear pretty hard tonight to just start screening these people. I mean, because it's our job, it really is our job. We need to start having conversations, and if you don't want to do it, then find a dentist in your community that you can refer them to. And because you don't have to do it, but hopefully we've lit a fire under you guys to get you going a little more.
The most common thing I hear after doing these courses, Rich, are, man, I'm really glad I did it this way. Because our fees for doing the in-person courses we were doing them were over $1,000, $1,400. You had to travel, you had to fly, I had to fly. And now if everybody comes to these meetings, that's why we limit it to about 30 people. Most of the people turn their cameras on. We have a very open dialogue, different from this. This is a webinar. We had too many people on here to do that with. That's why we limit it. So you can ask questions, and everybody's like, wow, it's just like we were in the same room. And then you go to bed with your husband or wife and don't have to spend the money on a hotel room. It's really a great way of doing it. And I think that's come out good, and we're doing a lot of virtual consultations with our patients now too, and that's become much more efficient and better for patients, and we'll talk about that during this virtual course. And so I think those are two things that have come out of this last year of kind of craziness that will remain forever. Along that line too are our telemedicine doctor opportunities that have lowered the barrier for dentists doing this as well. So it hasn't been all bad, so, and I know it's been stressful on everybody in lots of ways, but we've gotten some good things that have come out of it. So if you have more questions, and again, if you want a consult for free, just type in consult. This is the kit you get. And that's the next webinar someone typed in, wanting to see when that was again. I think I'll put our contact information up here once more.
Well, thank you, Guy, as always, for putting together a fantastic PowerPoint there. And, thank you guys for spending your evening with us. I certainly hope that you got something out of this.
Yes, I want to stop this so I can just see our faces here. I don't see any other questions. I see one. Looks like somebody's answering that. So, well, we hope to see you at one of the virtual courses, and hope you're doing some dental sleep. Well, if not, we'll see you on the next webinar. Rich, do you have anything more?
Yeah, I'm looking forward to seeing that, Guy. I know the Prosomnus people are talking about their new device and all that stuff. You know, we love we use a lot of different dental devices, and you know, I love the Prosomnus people, Guy, because they do try to put some science behind a lot of this stuff. They mill their devices. They're one of the few labs, I think, who consistently make that device at the bite that we're talking about, and they're kind of unveiling the next generation of this kind of thing. So I'm kind of anxious to hear about that.
Yeah, it's going to be great. And Mark Murphy, you know, he's always got a lot of knowledge, so I'm looking forward to working with him. And you all get to meet my partner, my other partner, Justin, Dr. Elikofer, and he's had a good year this year. In spite of COVID, we've been really busy in our sleep practice. So thank you all for attending. We'll see you then. I've got our people answering questions on here. Make sure they're not typing anything more. It doesn't look like they are. All right, then I'm going to hit the end button.
I think we're good, Guy.
All
Thanks,
right,
guys.
everybody have a good night. Bye-bye.